Hey everyone, welcome to today's Explainer. We're diving into a genuinely fascinating biological blueprint today. You can kind of think of the human body as this incredibly complex, delicate machine. But unlike a car engine made of rigid steel and bolts, our engine room houses these squishy, shape-shifting organs that are constantly moving, expanding, and contracting. So it begs the question, right? How does the body keep all these vital parts protected, organized, and functioning without them literally rubbing each other the wrong way? Well, to figure that out, we have to look at the body's internal architecture.
To really grasp the layout of the body, here is our agenda. We'll start with a welcome to the ventral cavity, look at crossing the diaphragm, explore the massive abdominopelvic cavity, check out the peritoneum's protective wrap, and finally, dive into clinical mapping and quadrants.
Section 1. Welcome to the ventral cavity. Okay, let's dive into this by defining our primary coordinates. Because, before we can even talk about the belly, we really need to understand the larger context, the bigger space it actually occupies. In anatomy, precision is absolutely everything. So whenever you hear doctors or anatomists use the terms ventral or anterior, they're simply talking about the front of your body or a direction toward the front. That's it. It's the exact opposite of dorsal or posterior, which refers to the back, like where your spinal cord and brain hang out. But our focus today? Strictly at the front of the house. Now, the ventral cavity isn't just some small pocket. It's actually the body's largest internal compartment, and its primary evolutionary purpose is, well, space. Sure, it contains delicate internal organs, but more importantly, it allows for significant changes in their size and shape. Think about it. Your lungs inflate with literally every breath. Your stomach expands way out after a huge meal. Your intestines are constantly contracting. The ventral cavity gives all of them the essential room they need to do their jobs without distorting other tissues or just totally disrupting nearby organs.
Section 2. Crossing the diaphragm. Let's see how this all builds as we guide our tour south, toward the feet, to see exactly how this massive ventral space is divided up.
The ventral cavity is essentially a two-story duplex. Up on the top floor, we have the thoracic cavity. That's the upper chest area, firmly enclosed by the protective bony rib cage, and it holds your heart and lungs. Down on the bottom floor, we have our main subject for today, the abdominal-pelvic cavity. This occupies the lower trunk, it's the single largest cavity in the whole body, and it houses your digestive and reproductive systems. But what exactly separates the top floor from the bottom floor?
Well, that physical border is the diaphragm, and interestingly, this structure is both a boundary and an active mechanical player. The diaphragm is this powerful, dome-shaped respiratory muscle. It forms the literal floor of the thoracic cavity and the ceiling of the abdominal-pelvic cavity. So every single time you take a breath, this border actually moves, pressing down on the belly to make room for your lungs to fill up with air. Pretty cool, right?
Moving on to Section 3, the massive abdominal-pelvic cavity. All right, having crossed the diaphragm, we are now officially entering the sprawling megacity of the human body.
And here is a highly surprising anatomical fact for you. Despite its long, kind of hyphenated-sounding name, there is absolutely no physical membrane or muscle that divides the abdominal cavity from the pelvic cavity. None. While it's super useful to distinguish between the two for medical mapping, functionally speaking, it's just one giant continuous space occupying the entire lower half of your trunk.
Let's look at the primary residence of the upper neighborhood here, the abdominal cavity. This area houses the real heavy lifters of the digestive system: your stomach, liver, gallbladder, pancreas, and the vast winding tubes of your intestines. It also houses a unique anatomical quirk, the kidneys. While they technically belong to this neighborhood, they sit in what's called a retroperitoneal position, meaning they're tucked all the way in the back, behind the main membrane of the cavity. It's almost like they're kind of hiding from the rest of the digestion party. As we drift further inferiorly, or lower, into the pelvic cavity, the landscape shifts. This space is funnel-shaped and bounded by the rigid bones of the pelvis. It basically acts as a protective cradle for things like your urinary bladder, the male or female reproductive organs, the rectum, and the anus. Section 4. The peritoneum's protective wrap. Okay, so cramming all these incredibly active, moving parts into one continuous space creates a rather dangerous mechanical problem. Imagine what would happen if your expanding stomach was just raw tissue, constantly rubbing up against the raw tissue of your liver every single time you ate or took a deep breath. The friction would cause massive inflammation and tissue damage within hours, no joke. So how does the body prevent this internal rug burn?
The answer is a biological marvel called the serous membrane. So the crucial point is, this is essentially the body's natural bubble wrap. It's a really thin, double-layered epithelial membrane that acts kind of like a bag. And its superpower? It actively secretes a slippery, lubricating fluid.
To understand exactly how this works, imagine punching your fist right into an underinflated balloon. The balloon forms two distinct layers around your hand, right? The outer layer, which lines the walls of the body cavity itself, is called the parietal layer. The inner layer, which wraps tightly around the internal organs themselves, the viscera, is called the visceral layer. And right in between those two layers is a microscopic fluid-filled space. Because of that fluid, the layers just glide seamlessly over one another.
Now, while the lungs have the pleura and the heart has the pericardium, in the massive abdominopelvic cavity, this protective double membrane is specifically called the peritoneum. This vital structure completely envelops your digestive organs, allowing them to churn, twist, and digest your food in a totally frictionless environment. It's a true game changer.
But like any complex system, things can go wrong. If the delicate balance of fluid production in the peritoneum gets disrupted, fluid can rapidly accumulate in that tiny space between the layers. This condition is called ascites. It's often caused by underlying issues like cirrhosis of the liver, and it leads to severe abdominal swelling and shortness of breath. It's a pretty stark reminder of why this matters so much. This microscopic layer of fluid is literally absolutely critical for our survival.
Section 5. Clinical Mapping and Quadrants. For our final act today, we really need to talk about navigation. With so many vital organs packed into one giant undivided space, how do doctors effectively communicate exactly where a problem is?
Well, as our source material notes, to promote clear communication, healthcare providers typically divide up the abdominal cavity. Think about it. Instead of a patient just saying, "My belly hurts," which honestly could mean an issue with any of a dozen organs, medical professionals rely on imaginary grid systems. This helps them quickly pinpoint pain, locate suspicious masses, and guide their reassessments. The most common system used in medicine is the four-quadrant approach. Picture a horizontal line and a vertical line intersecting right at your umbilicus, your belly button. This creates four distinct sectors. If someone comes into the ER complaining of sharp, sudden pain in the right lower quadrant, or RLQ, doctors know immediately to check the appendix. If the pain is in the right upper quadrant, they might suspect a gallbladder issue. It's an incredibly fast, efficient diagnostic map. But sometimes, four quadrants just aren't precise enough, especially for a surgeon or a highly specialized anatomist. For even greater specificity, the medical field uses a more detailed tic-tac-toe grid that divides the cavity into exactly 9 regions. This grid uses 2 vertical lines drop down from the collarbones and 2 horizontal lines. The resulting 9 regions give us highly specific coordinates. Right in the dead center is the umbilical region, anchoring the map right where your belly button sits. Directly above it is the epigastric region, literally meaning above the stomach, and directly below it is the hypogastric region. Then, flanking these middle zones, moving from top to bottom, you have the hypochondriac, lumbar, and iliac regions on both the left and right sides. It basically turns a vast, confusing space into a perfectly organized anatomical spreadsheet. We have covered a whole lot of ground today, from the macro borders of the ventral cavity all the way down to the frictionless peritoneal wrap and the diagnostic grids of the abdomen. So, based on the blueprint you've just learned, take a second and think. If you trace an imaginary cross over your belly button right now, which quadrant is your stomach sitting in? Well, if you pointed to your left upper quadrant, you're absolutely right. You now hold the keys to the map of your own body. But it does make you wonder, doesn't it? If this is just the surface map of the belly, what other hidden biological blueprints are operating inside you right now, completely unnoticed? Thanks for joining me on this explainer, and keep exploring.